So I'm going to start recording, so please stay muted. And I will start by discussing human trafficking stations. And then I will go to general psychiatrics, general tips about how to approach psychiatric stations. And we'll see how we can manage the time. I'm really sorry for being late. As I mentioned earlier, just because I was sending my daughter to sleep and I felt asleep myself. I'm really sorry. So, a human trafficking station. So actually, it's same approach like domestic violence stations, because even the lady in this station came with some injuries. And in this station or in this kind of station, they will write down for you medical treatment has been done. So do detailed psychiatric history. So they don't want you to touch the injury, whatever it is. So, or ask any history about it. Uh, so this human trafficking stations, the lady has some scalded injury on her tummy, and the nurse did the dressing for her. So talk to the patient and manage her condition. So the type of injury she has is suspected of domestic violence. That's why you're going to know it is not accident. And how we can find out, like how we will find out this is domestic violence and it's not an accident. So when you ask the type of burn itself, the location, and even like if they have bruises, for example, the location, and also the story can be changed a little bit, and you will find the patient distress, like or avoiding eye contact. If parents, they will try to stay with the child throughout the consultation. They don't want to leave their children, and sometimes they. Sorry, is someone talking to me, or this is just okay? So as a general approach to how to approach the stations, we will start by building some rapport with those patients. Most of psychiatric stations, like domestic violence and these stations, they will not open easily. So imagine like if someone received any kind of violence, why they don't want or suicidal risk attempt. Also, they will not going to open easily. So if you think like what the reason could hold them from talking, you will try to think it could be like just brainstorm with you right now. It could be like embarrassment of what happened, or it could be they scared that you're going to blame them for what happened, or maybe scared from someone else who did the violence, or they feel insecure, or they scared from the social service get involved, or they scared from confidentiality. So we never assume like if they are not opening with us, it could be due to confidentiality issue. So we need to find out what holding them back from speaking to them. So you can start by, hello, my name is Dr. Afag. I'm one of the junior doctor here. Can I confirm your name and age? So after that, you can, from the task outside, you know, this lady has burning in her tummy. So straight away go to the point, like tell her just, I understand that you have been brought to the hospital because of some scalded injury in your tummy. And I understand that the nurse has did the dressing for you. How are you coping now? So she will tell you fine. And can you tell her, can you just tell me what happened? So start to elaborate the incident. But when you ask what happened, they will not open up most of the time. So please stay muted, everyone. So just Thank you. Let me mute. Okay, so sorry. So when you ask what happened, they will not open up with you. So actually, the next step, you need to find out what makes them not speaking to you. So you can acknowledge the feeling or whatever you see. Like you can see them distress. You can see them facing away from you. You can see them looking down. You can see them. You will.
I don't see the far away object, so that's why I started using Swift.
You will understand. So please stay muted. You will understand what the feeling and you can acknowledge it back. For example, I can see that you look a little bit distressed. Is everything all right? And after that, offer support. So please don't worry, I'm here to support you. If there is anything you want to share with me, I will be more than happy to support you. And if they didn't open yet, you can ask even direct question like, I can see that you don't, there is something holding you back from talking to me. If you don't mind to share with me what is causing you, because I'm really concerned about you and I will do my best to support you. So try to offer all kind of support. And sometimes, for example, if it is domestic violence, they may fear that you're going to judge them for what happened. So tell them, I understand this is not your fault. And please, don't worry, I'm here to support you. So acknowledge what holding them back from talking and then offer support at the same time. And also you can tell them you are my priority, for example, and I will do my best to support you. So try to offer some few sentences about support, confidentiality if needed. And in addition to that, acknowledge the feeling. If it's not clear for you, you need to find out just by asking directly, may I know what holding you from not talking to me? I can see that there's something maybe distressing you or holding you back from speaking to me. So I would be more than happy if you can share me, so I will be able to help you. So they will definitely open up at some point and they will not stay like this forever. It just the third sentences, they will start to speak to you because they know there is some time management issue. As far as you offer support, confidentiality, and acknowledge their feelings, they will open up with you. And for example, if it is domestic violence and they have children, for example, so they may scare social service. So when you offer confidentiality, say, whatever you're saying, you're going to be confidential between me and the medical team, so obviously including social service. And when it comes to the social service in the management, they will be very upset with you why you involved in the social service. So you need to reassure them the aim of the social service is to keep the children with their parents and to support you. So just try to reassure as well. Okay, so this let's go back to the human trafficking station. So in the station itself, there is like a man who hiring some girls or brought some girls from their country because they have some visa issues. So he used them to do some dirty work for him, and he was very aggressive with them, and he keep harming them in different ways. And you need to elaborate all this in the history, like ask about the incident when she opened up with you, like you will going to ask her about the incident, can you tell me what exactly happened today, and has it happened before? And in our questions, we need to aim to the severity of the harm, like was it life-threatening or not? And has it ever happened that he could threaten her life? Because if there is any something like this, it has to be escalated to the higher level, because if because in the adult, in children station, children domestic or accidental injury, we have to involve the social service anyway without permission from the patient. But in adult, we need to involve the social service or police, whatever, by only their permission. If they only allowed us to do so. However, if their life has been threatened, we may need to somehow try to convince them to get the police or social service regarding to the management, get them involved. That's why it's extremely important to find out, if adults to find out, is if their life has been threatened somehow through their stay with this adult. And also we can elaborate the criminal or the one who did the domestic violence. We can elaborate his situation, like when he do this injury, was he under influence of alcohol or drugs? And does he keep any weapons at home, or has he ever used any knives, for example? And if, as I mentioned, if children involved, so we need to inform social service. That's why in any domestic violence station, including this station, we have to ask who else at home. Our questions is to aim, our question is to aim is to find if there is any children or vulnerable people at home, because if they are available, also we must involve social service and safeguarding and child protections. And as in any station in Plab 2, we have to offer like patient information leaflets, support group, and helpline. So here, for example, you can offer domestic abuse helpline. There is national domestic abuse helpline. And if children, we can offer childline. And yes, so in this domestic violence, when we ask who else at home, she will tell there is some girls. So we need to ask the age of the girls, because we need to find if there is one of them is less than 18. So also, and also in the management, you need to speak about, we're going to call the girl and assess their situation if someone has been injured by him or need any kind of support, including psychological support. Okay, and in general, sex trafficking, it's offensive act, and it requires to inform the police. So in this station, we're going to tell her, we're going to call the police for the man you talk about, because it's really, what he did is called human trafficking, and it's really against the law to do so. Well, and we're going to offer her support, and also in the station, all domestic violence station, we have to assess the mood, and if the mood is low, we have to offer support as well, psychological support. And talking about the mood, so we're going, so this domestic violence station finished, we're going to talk a little bit how to elaborate mood symptoms. Before that, if you have any questions regarding human trafficking, please, if you don't want to be recorded, because the session is recorded, so write down in the chat for me, please. If you don't mind to your voice to be shared with other doctors, so please feel free to ask me. No questions? Okay, let's read the chat. Okay, is domestic violence and human trafficking the same? So the slight differences between them. So human trafficking involved this station, specifically this station, involved domestic violence because the man actually have those girls in one home together, and he abused them. Like we have domestic violence as well. But the only different is domestic human trafficking is against the law, so police need to be involved, even if adult they refuse. So in domestic violence station, if adult refuse to get the social service and the police involved, we can no problem. We will try to convince them, but we cannot force the treatment on them because they are adult and their life are not compromised. As I said, we have to check this out in the history. But if it is human trafficking, we have to punish this man because it's against the law. So we have to, this is the only difference between them. And like just when you elaborate the history, you will find some few differences, like this man used them to do some like sexual activities and yeah, so on. But and also like in the station we have more than one person, so we need to check out the other girls, their age and their situation, if someone with from them harmed by him as well or not. But yeah, there is no big difference at all between them. We will take history, another one asking, we will take history, how she was harmed physically, mentally, sexually. Please confirm this. Yes, so we will ask, of course, we will ask all the questions, like when, for example, when you ask about what exactly, like you elaborate the current situation, like this parent, what exactly happened, what did he do, and how bad is the pain, because in the task is not written, so we need to find about how this pain was, the severity of the pain, like is it minor or too big, if it's not written in the task. And after that, we need, this is physically already confirmed by asking, but you're going to ask, has it happened before and how many times and what happened every time, each time he harmed her physically, what happened, what kind of physical harm happened. And sexually also you can ask, did he ever force you to do any sexual act? So some people use mnemonic heart, like does he ever harm you, or does someone help me? I'm just okay. So if he ever hurt you, or physically, or sexually, like this is what we need to elaborate in our history. And also we need to find if this lady has any kind of support, family, friends. We need to make sure she's fine when she's sent home. If not, we can think about offering her shelter as well. What if the patient doesn't want to inform the police in case of human trafficking? No, yeah, this is as I said, this is the only difference between domestic violence and human trafficking. Even if she didn't want to inform the police, we must inform, because we are not dealing with just a personal issue. We're dealing with a criminal act, which is against the law, human trafficking. And also there is other ladies who involved with this. The man do the same harm with other girls at home. So if she agreed, she didn't agree, even we are not going to convince her, we're going to involve the police anyway. Yeah, so yes, thank you. So Hark is like, does he ever humiliate you, afraid you, rape you, kick you? So how to ask? Like, yeah, but it's the same thing. Like, has he ever makes you feel little or belittle you? Do you feel safe with him? Has he ever forced you to do any sexual activities? And has he ever physically harm you? So straightforward questions. So another questions, 14 years girls in relation with 30 years old man. Do we inform parents first? Well, I think yes, we have to inform the parents, police, what child protection and safe guarding, all of them at once. We will inform everyone. We are not informing the parents to take their permission to inform the other safeguarding and child protection. No, just because this is big problem, so parent has to be informed as well. But there is no like priority. We have to inform the parent first, and then after that, get other. Because in this country, like children, they are not the parents. They don't have a decision for your children. Big issues like this, so it has to be in the best interest of the child. So this man or this is whatever teachers. I think he was teacher in the station. Has to be punished. Everyone has to be told about the incident, and parent as well has to be informed, of course. Welcome. Any questions? All right.
Doctor,
Hello.
sorry for interrupting you, but if you can give example how you ask the IPS, how you to show the embassy and sympathy. This is how to ask questions. Straightforward the question is okay, but how to ask?
How to ask, how to show IBS in the station?
Yeah, in this station.
Okay. Yeah. So let's start from the beginning. So I would say like whatever her name. So after introducing myself, hello Muna. Um, I'm really sorry for what happened today. So she came with a pen. I'm really sorry for what happened today. And please don't worry. I'm here for you. So something like this, or I'm here to support you. And after she open up with you, she tell you she heard me. Also, whatever happened. So I can see that you are going through lots of distress. I can see that how difficult your life is. I can understand that how this situation is difficult for you. But please don't worry. We will do our best to uh, support you with everything you need. So always, I would say a short sentence to acknowledge the situation, and always don't make it like uh, like I don't say I can see you are distressed because it doesn't show strong. So just make it like I can see how this situation is stressful for you. I can see how this I can imagine how you how this could be very stressful, how this could be whatever you say, how this is difficult for you, and straight away offer a little bit of support. Just please don't worry. Let me reassure you. We will here to support you, and something like this. So, what else? Let's see more sentences. Well, she said, for example, she doesn't have any legal papers, and she doesn't have family to support her here. So tell her, I'm really sorry. This must be really it's really difficult situation for you, and oh my God, just I'm really sorry. Even me, I'm really sorry today because the fact that I slept for 10 minutes, it makes my brain totally okay. So okay. I will share you some sentences, okay? I think I shared in the group, but you joined later, so I will share you lots of IBS sentences just to use them, okay? Different.
Yes.
Okay.
Can you send the link of group?
You did, last time we sent it here in the chat. You didn't.
Yeah. Yes. Sorry, I thought that I'm not in that group. Thank you, but I didn't see any sentence actually there. Since
yeah, because
I joined.
yeah, maybe when you join late, you may not be able to see. But I will share today. No
Thank you.
worries.
Thank you very much.
You are welcome. So you are in Plab 2 guide group, yeah?
Yes, doctor.
Okay, I will share it today. Don't worry.
Thank you. Thank you very much.
Welcome. Okay. If she has no family, so social service will provide accommodation and financial support. Well, yes, but in this station, sorry, there is some echo, so stay muted. So I will. So normally we can offer social service can offer accommodation and financial support for some people who has legal papers, but this lady, unfortunately, she doesn't have legal paper. So she might face some problem actually, because but you can reassure her, like she will tell you, for example, you are not going to help me because I don't have legal paper here. So tell her, yes, I understand this could be a very challenging situation and you may face some problem because of that. However, there is some charity organization, even the home office, if you explain that the situation in your country is like is not safe for you, like your life in your country is not safe there, they can offer you refuge, yeah, and you can seek refuge here in this country by telling them you are not safe here, yeah. So you, because if she doesn't have legal papers, they may send her back home. But if she applied for refuge, they may consider her case if her country situation is not safe. There is some war or some any kind of unpleasant situation in her country, she can explain. Okay. Any questions? Please ask me, because when you ask me, you will make me think better. Now I can't think what I can say for you.
Okay, and this patient will admit him, yes, doctor?
Yes, so we're going to keep her in the hospital just to sort out her problem, because she's not safe to go back home. Yeah.
And after that, we'll refer her to any department, like the psychiatrist or anything?
Yes, just because she doesn't have legal papers, so just you need to tell the social service. They will have what they will know
Because she
how to
have
deal with her. Yeah.
shock. She's shocked and she's have some difficult time, or no need for psychiatrist at that time.
Sorry.
Did she need to refer to psychiatrist?
Yes, so we need to elaborate the mood. So as I was telling, so in any, like if you have any, you need to assess depression in any patient, you need to ask about, can you please score your mood for me? And then ask the depression question, like over the past, 2 weeks. So to say the patient has depression, they have these symptoms, it has to be at least for 2 weeks. Depression symptoms like have you lost interest or pleasure in what you're doing, the daily activities, and what else? 1 second. Okay, so the main two questions you're going to ask, like during the last months, for example, have you been often bothered by feeling down or depressed or feeling hopeless, for example? And another question you will ask, do you have little interest or pleasure in doing things? We will ask over the past months, but at least they have to be for 2 weeks, at least 2 weeks, to be able to diagnose depression. If someone told you my mood is 0 today because of this incident, because of this domestic violence, it does not necessarily means depression, because it's just for 1 day. So you have to establish, ask her, how is your mood over the past months? And you ask these 2 questions, like, have you been feeling down over the past months? And also, do you have little interest or pleasure on doing things? After that, you will ask symptoms related to depression, like before you ask other symptoms, you tell how often do you experience these symptoms, which is feeling down and losing interest and pleasure on things. So how often do you have these symptoms? Because they will estimate the severity of symptoms of depression. And then you can ask other symptoms of depression, like sleep problem, appetite problem, and poor concentrations, and feeling hopeless or worthless, and suicidal attempts. This is about depression station. So you have to ask these symptoms and tell the patient has depression. Symptoms has to be for the past 2 weeks at least, as I mentioned. That's why you will ask over the past months, have you did this or this, the question I just mentioned now. And there's some questionnaire to calculate or to estimate the severity of depression. I also shared in the group. You may refer to group media, you may find it. So it will tell you the severity. So if it is mild, we will offer CBT. If it is moderate or severe, we're going to offer CBT in addition to the antidepressant.
Can you resend all this again, doctor? Because we didn't find it. Sorry
Okay.
for interrupting you.
Yeah. Ask me any question. You don't need to say sorry. I'm here for you, actually. So please, yeah, I will share everything. Or you know, you have my number, isn't it?
Yes, doctor.
So I will share you whatever you want. Like because I shared over the past 4 months lots of things. So whatever you need, just I will share you directly. So another one asking if the patient is over 18 and does not want to inform the police or social service, do we still inform or not? No, we don't inform if adult and they have mental capacity. If adult and they have mental capacity, we don't inform, we don't like force any kind of treatment on them, including CPR. So this is something, it has to be established, like any adult who refuse treatment, we just check mental capacity. If they are fine, we don't inform any kind of social service, police into them if they don't want. However, just as I mentioned, we have to check if there is anyone else being harmed by this domestic violence, being affected, like if there is children or vulnerable people at home, even if this adult, like for example, mother, and she has a child, we must inform the social service, because even if she said that the husband doesn't hit the child, still psychologically the child has been harmed, so we must inform the social service as well, even if they are not agreeing on that. Okay. Any more questions? Okay. So I'm really sorry because this is Ramadan. We are fasting, so I will finish here. And Dr. Ahmed, please send me in private. Yes, I need to know your number to share you whatever you want.
Thank you. Yes, of course.
Welcome. And thank you so much, everyone. And I'm really sorry for joining late again. And have a very good evening. See you next week.
Thank you.
You are very welcome. Bye-bye.